Well, good morning, ladies and gentlemen. I'm Michael McGroby, the president of Indiana University, and I want to thank all of you for joining us today for what I'm sure will be a memorable and unforgettable day for the city of Bloomington. And we're joined this morning by a distinguished group of representatives from Indiana University Health, from the IU Health Bloomington Hospital, various state and local government officials, and representatives of the faculty and administration of Indiana University Bloomington. I'm especially pleased to welcome two members of the Indiana University Board of Trustees who are here with us today. First, Randy Tobias of Carmel, who's chair of the trustees and incidentally vice chair of the IU Health Board, and Phil Eskew Jr. of North Webster, Indiana. Please join me in welcoming our trustees. Today, we really are delighted to make a number of announcements that will constitute a true milestone in the history of healthcare for our city, for Southern Indiana, and for that matter, for the entire state. To begin these announcements, I'm very pleased to welcome the President and CEO of the IU Health Bloomington Hospital, Mark Moore. Mark.
Well, good morning. My name is Mark Moore, and I'm the president of IU Health Bloomington in the South Central region. Today, you'll have the opportunity to hear three very exciting announcements. I'd first like to acknowledge, though, the board members, hospital staff, physicians, and other leaders who have been able to join us today, as well as our IU colleagues. Thanks to all of you for the valuable contributions you provide to our community. Thank you very much. I also believe in attendance is Bud Core, and Bud, right here. Bud has a special place in our heart. He was the CEO of Bloomington Hospital for close to 30 years. Bud, thank you for bringing us to this point. I'm going to have to hang on up here. The wind is starting. IU Health Bloomington has a rich heritage. The vision and hard work of the local council of women resulted in the opening of Bloomington Hospital in 1905. From a 10-bed hospital, we've grown to become the regional referral hospital for IU Health's South Central region. We've evolved from one location to a system with dozens of outpatient locations and physician offices across the region. Throughout South Central Indiana, IU employs more than 5,000 people. Since our start 110 years ago, healthcare and community needs have continued to change. Our vision is to be the preeminent healthcare provider of choice by always being patient-focused. We also want to be a place of innovation where students, clinicians, and faculty participate in the design of a new model of healthcare for the future. We've said many times that a vision like this requires a new modern hospital and ambulatory care facility, one that will be flexible and evolve as healthcare advances over the coming decades. So today, I have the great honor of sharing with you, on behalf of the IU Health Bloomington Hospital Board of Directors, that we will locate the new IU Health Bloomington Hospital on this very site as part of a bigger health and education initiative that you will learn more about shortly. I'd also like to, yes. It truly is historic. I'd like to take this opportunity to personally acknowledge President McGroby and thank him for the vision to create a regional academic health campus for this area of Indiana. This will have positive ramifications for generations to come. Thank you, Michael. This is an incredibly exciting time in our hospital's history. We look forward to taking the excellent relationship we have with the university to the next level and create enhanced opportunities for education, clinical research, program development, and community outreach. Now it is my pleasure to introduce Dan Evans, President and CEO of the IU Health System, for his remarks and to thank him for his leadership with this direction. Dan?
Good morning, everybody. I'm Dan Evans, the CEO of IU Health and IU grad and IU Law School grad. This is the first time I've been in this spot with my back to the golf course. So if you don't mind, my mind is here, but my heart, I got to tell you, is out there. Thanks for your attendance today. It's great to see so many friends and colleagues that have come to share the good news we're announcing. 5 years ago, seems like yesterday, when we, IU Health, invited Bloomington Hospital to join IU Health. We did so because we knew in Bloomington we had a partner who shared not only our commitment to preeminent patient care, but also to the education and research components of IU's three-part mission of excellence in clinical care, research, and education. We have hospitals in every college town in Indiana, Muncie, West Lafayette, and here, so I know wherever I speak when I say the assets here are particularly unique for this partnership. At that time, Bloomington Hospital was already providing learning opportunities to students in medicine, nursing, allied health professions, the social sciences, public health, and many others. It was also carrying out a number of clinical research studies, often in collaboration with colleagues at the IU School of Medicine in Indianapolis. The relocation of IU Health Bloomington Hospital on this site will provide unprecedented opportunities for the interprofessional collaboration and innovation with Indiana University and its medical and health-related schools. This venture will ensure that patients from throughout southern and south central Indiana have access to leading-edge treatments, therapies, and clinical best practices. Those are not just words. Those can only happen with the kind of interdisciplinary team approach that we're talking about creating right here. So in that vein, I'd like to announce now that IU Health, together with IU, will create a regional academic health campus where we will foster a collaboration of our clinical research and education expertise to advance healthcare and benefit the patients we are so privileged to serve. This campus environment will enhance the training of IU medical and nursing students, as well as social workers and other healthcare specialists in training. Patients will benefit by receiving care right here in Bloomington from faculty at the leading edge of medical research and treatments. It will also be the ideal training ground for students who are the next generation of healthcare professionals. We still have much work ahead of us. In case you haven't noticed, healthcare is in a state of high change right now. But for now, I want to extend our deep appreciation to President McRobbie and IU and to Dean Hess and the School of Medicine for their continued partnership and for embracing this bold and transformative step to create an environment that will train future clinicians, stimulate medical innovation, and advance healthcare in the state of Indiana and beyond. Next, I'd like to invite up to the podium President McRobbie to make his second appearance of the morning before the group. Michael. Thanks so much.
Well, thank you very much, Dan. I'm pleased to follow Dan's announcement by noting in particular that in addition to the decision to locate the new IU Health Bloomington Hospital right here on this site, that Indiana University will bring together most of IU Bloomington's academic health science programs into one place to be co-located with the new IU Bloomington Hospital here, thus creating, again what Dan indicated, will be the most comprehensive academic health campus in the state outside of Indianapolis. This in turn will greatly expand the opportunities for health sciences education and research at IU Bloomington, for innovative new programs in interprofessional education, and for new clinical services at the new hospital. IU Bloomington currently has an extensive portfolio of academic, research, and clinical health programs, in fact, the largest collection of such programs in the state outside of Indianapolis. These include the Medical Sciences program, which is part of the IU School of Medicine, as well as programs in nursing, in social work, in speech and hearing sciences, in optometry, and in public health. But all of these outstanding programs have been constrained by space, especially in terms of clinical training. The medical sciences and nursing programs in particular have long suffered from aged and cramped facilities. Their current facilities constrain their ability and capacity to expand enrolment. They hamper their ability to offer modern training techniques, and they limit faculty research space, and therefore they limit research opportunities and research funding. To meet the substantial demand for increased numbers of physicians in our state, the IU School of Medicine has expanded the capacity of its 8 centres of medical education around the state, including here in Bloomington's Medical Sciences program, the school's largest program outside of Indianapolis. The Bloomington program could in fact increase its enrolment from an entering class of 36 to approximately 50 students per year, but is challenged again by ageing and limited facilities. The IU Bloomington School of Nursing turns away somewhere between 200 and 250 qualified applicants each year, many of whom have excellent academic records. Given adequate teaching and research space, this program could easily double in enrolment. In the shorter term, the program will increase enrolments by about 20 students per year and work to develop new degree programs in nursing to meet the evolving market demands for nursing specialities in the future. Expanding these and our other health sciences education programs will allow us to serve additional students, thus helping to address the acute shortage of healthcare workers in the state. It has been said that no factor has been more important to the extraordinary achievements of medical practice in the United States in the last century: a major increase in life expectancy, declining infant mortality, control of infectious diseases, and important advances against cancer, coronary artery disease, and stroke than the country's academic health centres. And I'm delighted that IU and IU Health, who together comprise the state's largest employer, will be able to expand what is truly a productive partnership to bring to Bloomington and to South Central Indiana some of the benefits and services associated with our large-scale comprehensive academic health centre in Indianapolis. With the proximity of the new site to IU's Technology Park, which runs all down the bypass here, we will be able to leverage one of the most advanced information technology environments in the world to offer state-of-the-art training techniques to our students and to support health sciences faculty research. I'm also enormously pleased that Indiana University will be able to play a role in keeping the IU Health Bloomington Hospital in the city via public transportation and major highways and offer room for future growth. The announcements we have made today reaffirm that Indiana University and Indiana University Health share a commitment to excellence and a commitment to the people of Indiana. IU Health and IU Health Bloomington Hospital have been and will continue to be great partners in supporting Indiana University's mission of education and research excellence. And my thanks go to Mark Moore, the CEO of the IU Health Bloomington Hospital, to Dan Evans, CEO and President of IU Health, to their respective boards, who've been very supportive of these initiatives, and to all members of the community, and I know so many of those people are here today, who have worked together to reach this milestone. And I also want to take just a moment to thank a number of Indiana University colleagues whose dedicated efforts have helped to make today's announcements possible. And I think you'll understand something as large and complex and sophisticated as this has had the involvement of many people quietly behind the scenes. And these people are, and you'll hear from her a little later, IU Executive Vice President and Bloomington Provost Lauren Rebell, Vice President for University Clinical Affairs and Dean of the IU School of Medicine, Jay Hess, from whom you'll also hear, Vice President for Capital Planning and Facilities, Tom Morrison, Vice President and General Counsel, Jackie Simmons, Vice President for Engagement, Bill Stephan, Senior Vice President and Chief Financial Officer, Mary Frances McCourt, and Vice Provost for Graduate Education and Health Sciences, David Daleke. Maybe you could just join me in thanking all of our IU colleagues as well. We greatly look forward then to our continued partnership with IU Health and the IU Health Bloomington Hospital as we work together to support the highest quality research, clinical care, education and workforce development in the health sciences and to more effectively serve the health needs of all Hoosiers. And now it is my great pleasure to introduce the Mayor of the City of Bloomington, Mark Grisand. Mr. Mayor.
I don't mind telling you, the wind chill factor up here is about 20 degrees colder than it is down there. So if you see Joyce, Pauline, and I huddling together, it's not only out of a sense of bipartisanship, but out of a sense of survival. If there's one thing that's become clear of late, it's that this community values its primary hospital, and so does Indiana University. Today marks the beginning and the bringing together of the best of two worlds. Campus and community both benefit from the decision by IU to step in, step up, and invest in the future of the hospital and healthcare in Bloomington, Indiana. That benefit comes in myriad manners. The literal and symbolic connection between IU and the hospital located within our city strengthens the already strong bond between IU and Bloomington. Its prime bypass location makes it readily accessible to a good portion of city residents and still easily accessed by others both within and outside the county. Unlike the North Park location, this site is within public transit's service territory. Unlike the North Park's location, this land is already property tax exempt. It's the kind of thing mayors think about, especially on April 15th. IU and IU Health Bloomington Hospital are so ingrained in our community consciousness that we may sometimes take for granted their presence. It's critical to recognize this partnership represents Monroe County's first and third largest employers undertaking an enterprise in which both will grow and prosper for decades to come. The increased purchasing power, as well as hiring and giving potential, will be significant. Both entities, independently and jointly, will continue to be engines fueling the local and regional economies. There's no doubt Bloomington and Monroe County residents will benefit from the advanced offerings and highly trained professionals at the new campus, as well as from the extensive community outreach and support provided by both institutions. And finally, having the hospital locate within city limits is important to our community identity. It's a sign that ours is a community in which important institutions invest, in which the welfare of our citizens is tended to, and in which our economy is, in this case in particular, driven by the promotion of quality of life. Today's announcement is the very dictionary definition of momentous, and it's an honor to participate in it. Now we'll turn it over to our provost, Lauren Robel.
Good morning, everyone. As the Chief Academic Officer for the Bloomington campus, I am just beyond delighted by both the immediate and the long-term benefits this partnership will bring to our community, our campus, and our state. So many of our country's most stubborn and debilitating health issues call for multidisciplinary, collaborative solutions. And this is particularly true of issues surrounding the delivery of high-quality health care to all members of our community. At IU Bloomington, we find ourselves in a unique position to effect wide-reaching and long-lasting positive changes in these areas of health care. As the President noted, the Bloomington campus is home to the largest group of health sciences programs in the IU system outside of Indianapolis. As of fall 2013, 531 academic appointees and postdoc fellows were working in the health sciences on our campus, including 172 tenure-track faculty members. Together, these researchers and healthcare professionals brought in approximately $36.6 million in outside research funding, a figure sure to increase with the expanded programs and facilities that will result from the creation of the new Regional Academic Health Center. This benefits not only IUB faculty and students, but the larger Bloomington community as well, since every research dollar represents the potential for job growth and economic development in our region, in addition to improved health care for our citizens. IU Bloomington's programs in the health sciences are numerous and diverse, encompassing nearly every school on the campus, in addition to several nationally regarded research centers and institutes. We currently have over 1,200 undergraduate and graduate students studying in our core health sciences programs, and such students constitute over 17% of our current graduating classes. Many of the core health sciences programs already enjoy strong clinical and educational relationships with IU Health Bloomington Hospital, and today's announcement ensures that these relationships will grow more numerous and more robust in the future. From the School of Public and Environmental Affairs new degree program in hospital management to the Department of Psychological and Brain Sciences Clinical Sciences program, the entire campus benefits from the research collaborations made possible by the co-location of our core health sciences programs and the hospital. And the Bloomington community benefits as well. In 2012, IUB faculty and students provided more than 300,000 hours of health-related service to our community. Further proof of just how integral the IUB health sciences programs are to the well-being of the Bloomington community as a whole. The co-location of our facilities will strengthen this already strong relationship. And the hospital, its patients, and its practitioners will benefit from much easier access to IU Bloomington's outstanding faculty, its state-of-the-art simulation labs, and its training resources. The creation of the Academic Health Center corresponds with exciting developments in our approach to healthcare education at IUB. As part of our campus strategic planning process over the past year, led beautifully by Vice Provost David Dalekey and faculty in our core health sciences, our faculty produced a comprehensive vision for the future of health sciences education at IUB, one defined by a commitment to interprofessional education. Healthcare, whether in hospitals, community clinics, or private offices, has increasingly become a collaborative, team-based practice. And interprofessional education brings together students from all areas of the health professions, nursing, medicine, social work, public health, optometry, and others, to learn from each other and hone their talents as members of a team. This kind of education helps students develop essential communication and collaboration skills to facilitate their work with fellow professionals in their own and other disciplines. And this kind of education was just not possible in the kinds of facilities that the campus had before this announcement. What this move makes possible then is a trifecta of opportunities for our campus and community. One, the opportunity for a collaborative team-based approach to teaching that brings together our core health sciences programs. Two, the opportunity for innovative interdisciplinary research and clinical initiatives made possible by co-location with a hospital in a technologically advanced facility. And three, the opportunity for increased access to first-rate services for the many patients who rely on the healthcare supported through the long-standing relationship between IU Health and IU Bloomington. This is a win, win, win. I could go on with wins. Many, many wins. I'm very grateful to our faculty and to our partners, and I'd like to introduce Vice President for Clinical Affairs and Dean of the Medical School, Jay Hess.
Good morning. IU Health and the IU School of Medicine have a unique synergistic partnership, one that enables us to improve the health of patients of today and through our education and research patients in the future. Our partnership makes it possible for us to not only make discoveries, but to rapidly translate these discoveries into better care, to provide innovative therapies that aren't available elsewhere, to test new ways of providing health care to improve quality and to control costs, to train the next generation of healthcare professionals, and to create scientific and business opportunities that will fuel economic growth in the region. The construction of a new hospital in Bloomington, coupled with a medical education building, will greatly advance our mission by providing a state-of-the-art venue to prepare our learners for the increasingly complex environment in which they're going to practice. Furthermore, Indiana has a shortage of physicians, particularly in primary care. We know that a high proportion of the students who train at the regional campuses choose to continue their careers there. So this facility will help address Indiana's workforce needs. Through our affiliation with IU Health, the IU School of Medicine is able to make clinical trials available across the state, affording patients with the most complex and difficult diseases an opportunity to benefit from innovative new therapies. And these studies also make it possible for us to benefit from our experience so that we can improve care for patients everywhere. We're also leading a number of initiatives to facilitate interactions between the School of Medicine, IU Health, and the private sector, including pharmaceutical companies, clinical research organizations, and medical device companies such as Cook Medical, which is headquartered right here in Bloomington. Working together, we'll continue to harness the collective expertise of all of these organizations to prepare the nation's top healers, to deliver high-quality, efficient care, and to develop new therapies that maximize the health and well-being of every patient we serve. Thank you. And now I'd like to introduce Dr. Jonathan Surdam, who's the Chief of Staff at IU Health Bloomington Hospital.
Thank you, Dean Hess. Good morning. My name is Jonathan Surdam, and I am IU Health Bloomington Hospital's Chief of the Medical Staff. It is my honor to lead a tremendously dedicated and talented team of physicians who are focused on providing the best care possible for our hospital's patients. As an orthopedic surgeon, I evaluate treatment options through the eyes of my patients. What does this treatment option mean for them? How does this affect their lives? I believe that changes to our hospital and the way that we provide care in our region should be evaluated in the same manner. What does this new hospital and our relationship with Indiana University mean for our patients? We know that higher education and hospital partnerships create an environment of constant learning and research. This allows us, as physicians and healthcare providers, to continually improve the way that we deliver healthcare to our community. With this partnership, we will be at the forefront of the future of medicine. We will have more opportunities to participate in clinical research, helping to find new treatments for our patients right here in the South Central region. Our patients will benefit directly from this partnership as we help to create better standards of care. As physicians, we are driven to help people. We try to make their lives better and improve the health of our community. With this more expansive collaboration with Indiana University, we will not only be in a position to improve the care for our patients, but also be able to be more involved in the training of the next generation of physicians and healthcare providers. I was inspired to become a physician after I was able to observe firsthand the kind of impact healthcare providers can have on people's lives. My neighbor growing up was a pediatrician, and watching him and the way he impacted and affected change in the community inspired me to become the surgeon I am today. I hope that we can be the inspiration for these students as they grow into the nurses and physicians of tomorrow. Thank you. It's my honor and privilege to introduce Joyce Poling, the chair of the IU Health Bloomington Hospital Board of Directors.
Thank you, Dr. Surdam, and I am pleased to be here today and proud to be chairman of the IU Health Board of Directors. As Mark mentioned, the IU Health Bloomington Hospital's history is rich with community involvement. I see this sense of teamwork continually in the diligent work of our board of directors and hard work of our staff and leadership. To the many groups who have contributed to our success, we take pride, and we thank them for their can-do spirit. As Mark said earlier, the hospital has benefited greatly from its relationship with the local Council of Women. The start of the hospital was a historic event for the community. As the hospital grew, financial resources were needed. Monroe County government stepped in to help. For this partnership, the county requested and received appointments to the Bloomington Hospital Board of Directors. This partnership exists still today. I am proud to be part of the local Council of Women and the work they still do to benefit our community. I would like to acknowledge and thank the members of the local council and ask them to stand and be recognized. I want to make clear, none of them were here at the beginning. It is their original vision that allows us to look into what healthcare will look like in 100 years. We know that it's teamwork that allows us to succeed. Today, as we announce this wonderful collaboration, it is exciting to think about the opportunities this enhanced partnership will bring to our region. We will have two of our largest organizations working even more closely. They will bring new ideas, research, and impact both healthcare and education for future generations, and will continue to foster the sense of community for which our area is known. As a hospital that began with the care and concern of a group of women, I am pleased to see IU Health Bloomington and Indiana University come together to benefit our community and our region. This is another historic day. Thank you, and now I'd like to introduce Lynn Coyne, President of the BEDC, and also Vice President of our hospital board.
Thank you, Joyce. Welcome, everyone, today. It's a historic, momentous day for sure. When I was invited to speak, I had to pinch myself because you understand today is the day of the Bloomington Economic Development Corporation's State of the Bloomington Regional Economy Luncheon. I don't know what I'm going to talk about. Being here, this is a pleasure to be part of what is an announcement that will have a profound impact on our community for years to come. I'm honored to participate. In addition to my role as president of the Bloomington Economic Development Corporation, I am distinctly honored to be vice chair of the IU Health Board of Directors, Bloomington Hospital. In that capacity, I want to assure you that we thought very long and hard and seriously about the decision to where to locate this hospital and its impact on the community and our patients for years to come. We were reminded constantly that this is a decision that comes about once every 100 years, if then. In today's dollars, the economic impact of IU Health Bloomington Hospital alone pumps nearly $500 million into our regional economy. That does not consider the impact of the new building that's going to be built back here, the new hospital, the ambulatory care center, nor does it consider the investment in the facilities and programming of Indiana University. Bloomington has an established reputation as a livable, healthy, entrepreneurial community that is known for its big city amenities and its Midwestern charm. And now that reputation takes a giant leap forward into the future with this announcement of the creation of a healthcare and educational campus like no other in Indiana and perhaps no other in the nation. It's a great time to be in Bloomington. It's an even greater time to do business here in this region. Thank you for having me as part of this ceremony today, and I'm going to turn the program back over to Mark Moore. Thank you for being here.
From an idea to an innovative concept to the beginning of a journey. That's where we are today. That concludes our program. We thank you for being here today. I'm sure all of us will be available for questions and really appreciate you being here to participate in this celebration. Thank you.